I'm Jennifer Donnelly. I'm consultant obstetrician, maternal fetal medicine specialist working in the Rotunda.
My name is Fionnuala ní Ainle. I'm a hematologist or blood doctor, and it's my privilege to look after women who are pregnant, who have had blood clots or who are at risk of blood clots. And I work here in the Rotunda Hospital in Dublin, Ireland, and also in the Mater Hospital in Dublin. Blood clots or venous thromboembolism in pregnancy can be a devastating event with far-reaching consequences for a woman's family, her friends and society. So it's really important that we understand how best to prevent blood clots in pregnancy. What I mean is venous blood clots, so a deep vein thrombosis, which occurs in the leg and can travel to the veins around the heart, called a pulmonary embolism. And even though we know that when you are pregnant, you're at much higher risk of developing a blood clot than you are when you're not pregnant. And we know that there are lots and lots of risk factors for developing a blood clot when you're pregnant. We don't yet know the best way to prevent a blood clot, particularly after baby is born. And I suppose in some higher risk situations, we are delighted to have more information and more data through recent high impact, really important clinical trials. But there are still lots and lots of unanswered questions.
The purpose of the PARTUM pilot trial was to see, was it feasible to conduct a double-blind randomized control trial on the use of aspirin in the postpartum period to reduce the risk of VTE in this population. And the reason we needed to do a feasibility study is that trying to recruit women in the postpartum period can be challenging. And many studies have fallen on this before, because obviously the postpartum period is a time of great change for women, both physical and emotional, and for them to partake in a trial, many studies have found it difficult to get them on board in terms of getting accurate consent, and in terms of them being able to take in the information when their focus is on their birth and their newborn. So we really wanted to see, was it possible to do the trial in this population group, which, with previous experience of working both clinically and in research in this population group, we were confident that we would be able to find ways of engaging women and study participants in the trial in this very vulnerable time. And we were really heartened and delighted to see how many women were very committed to participating and completing the trial. And we're very, very grateful for all the participants for giving up their time and for also the commitment to try and improve things for others. So this is a double-blinded, placebo randomized control trial. This means that the study participants, when they agreed to take part, were randomly allocated into one of two groups. Both groups were taking the medication, which in this case was aspirin, or a placebo. And the study participants and the researchers did not know which group they were in. This means that the study participants could have been either taking aspirin or a placebo. So the study medication was given for up to 6 weeks in the postpartum period, and during this time, neither the study participants nor the researchers were aware. In order to use a placebo and an active medicinal product, it's very important that the trial is governed carefully and with very strong governance. We were very grateful to the RCSI research department in helping us develop the protocol, develop the study, and ensuring that we complied with all the regulations around the use of a medicinal product, particularly in the postpartum period. So we felt very fortunate to be able to do this trial with the support of RCSI.
A trial like PARTUM is absolutely crucial. On one hand, we must never miss an opportunity to prevent blood clots in women who have a need for prevention. We don't know yet exactly where that trigger point is. And it's not a straightforward question because blood thinning medications also have side effects. So hitting that balance, and importantly having high quality evidence for when to hit that balance, is incredibly important. We want to be able to deliver the right treatment to the right patient at the right time. The results of the pilot phase of this trial are expected probably in early 2024, once all of the incredibly committed pilot sites have completed recruitment and data have been analysed. We look forward enormously to the results of this pilot trial.
The key team member was Dr. Claire McCarthy, who was a maternal medicine fellow in the Rotunda at the time. And without their support and very hard work, this trial wouldn't have gotten across the line. As well, I'm really delighted to continue my work with the RCSI Rotunda Research Department, who were critical in getting this done. Also, given that it was a SIBO-controlled medication trial, our clinical trials pharmacist, Elena Fernandez, and all of the pharmacy department have been extremely helpful and key in getting this done safely.
And we congratulate the leadership of Dr. Leslie Skeeth, who has led this crucially important trial. On behalf of all care providers who look after women at risk of blood clots, and I think on behalf of all the women themselves, we thank you for your leadership, Dr. Skeeth.